Sarah,
Excellent, no problem.
set up here. Perfect. I'm just get a quick thumbs up from Sarah if she can see the screen. Yes, brilliant. Super. So thank you very much, Sarah, for that introduction. So as Sarah mentioned, the focus of today is around CHAMPS, which is a 12-week home-based physical activity program for for survivors of childhood and adolescent cancer. So throughout today, I'm going to take you along the journey. There we go. So the focus of today's presentation is along my PhD journey, and I'm going to replicate that today for you all. So first of all, we're going to get started and actually discuss childhood and adolescent cancer. So with childhood and adolescent cancer in Ireland, we know that approximately up to 190 young people aged 15 below receive a cancer diagnosis each year. And in addition, up to 70 young people between the ages of 16 to 24 years old receive a cancer diagnosis annually. And among this group, we know that the most common cancer types include brain tumours, central nervous system tumours, leukemias, and lymphomas. And we have a number of childhood, adolescent, and young adult survivors of cancer here in Ireland, with approximately over 7,000 here with us today. We've also seen an increase from 82% all the way up to 87% for the 5-year survival rate for children. And in addition, we've seen an increase of 87 to 90% with the 5-year survival rate for the AYA, which is our adolescent and young adult community. So due to the incredible advances in both the treatment and management of cancer during youth, we're seeing an increase in that 5-year survival rate. But up to 90% of these young people may be experiencing side effects post-treatment. So let's just pause for a moment and think about if we had 10 young people sitting in front of us today who have had cancer, up to 9 of these young people sitting in front of us may be experiencing side effects post-treatment, which can occur months up to years after treatment. And what type of side effects may be they experiencing? So regarding immediately after treatment, we know that many young people who have had cancer may have muscle weakness, high levels of fatigue, lower fitness levels. They may have memory difficulties. There may be behavioral changes. They have feelings of isolation, being excluded, and a lack of awareness. They may have a low mood, they may have high levels of anxiety, and all of which contribute to poor levels of quality of life for these young people who have had cancer. And what about in the years after their treatment finishes? What are the chronic side effects of their treatment for young people who have had cancer? So research tells us that there's an increased risk for the development of cardiovascular disease. There's an increased risk of secondary cancer, an increased risk of pulmonary conditions, and also reduced mental well-being among this population. So knowing all this knowledge, how can we actually support childhood, adolescent, and young adult survivors of cancer? So myself and my research team focus on physical activity and how physical activity can be used as a strategy to support young people after treatment with managing their side effects. But first of all, let's look at what exactly do I mean by physical activity. So physical activity is described as any movement of our body that requires energy being spent. And if we think of physical activity as an umbrella term, within that umbrella, we have 3 different categories. Our first category is our activities of daily living. So any free movement we do during the day, such as cleaning the house, going shopping, going for a leisurely walk. Our second category is we have exercise, where the goal of this session is to increase our fitness. So for example, lifting weights, taking part in a yoga or a dance class, running on the treadmill. And then thirdly, we have sport, which is an organised activity completed to a set of rules. And specifically in Ireland, we have many sports available, such as Gaelic, soccer, hockey, hurling, tennis, and so on. So we know what is physical activity, but why is it actually important for both children and adolescents? So we know regarding their muscle and bone development, research tells us that young people who participate in regular physical activity, we see an increase in their muscle mass, and it also optimizes their growth and development of their bone health. Regarding their heart health, we see an improvement in their cardiorespiratory fitness, and it can also lower their blood pressure. We see with their brain and cognitive function, we see a release of those beneficial neurotransmitters such as dopamine. And improvements in academic achievement is also seen among young people who participate in regular physical activity. Regarding their lung health, we can also see improvements in their respiratory muscles and improved lung capacity. But what are the many other benefits for people who take part in regular physical activity? So let's have a quick look at the psychological benefits. So we know those who are regularly active see lower levels of anxiety, lower levels of depression, they have better sleep quality, they have greater enjoyment in life. We see improved mood, greater self-confidence, and it also provides an opportunity to expand their social connections. What about then the many other physical benefits of physical activity? We know that those who participate in physical activity feel more energetic. They have greater balance, which therefore reduces their falls risk. We know that it can improve flexibility, increase our cardiorespiratory fitness. We have a healthier body composition, and it can also assist in improving our coordination or our fine and gross motor skills. So if you think back to the previous slide of all of the systems on how physical activity is beneficial for those, plus our psychological on the left, and also our physical benefits in the center. All of these factors contribute then to huge improvements in the quality of life among those who participate in physical activity. But what about when we're adults? Taking part in regular physical activity can actually help with many chronic diseases. So we see reductions in the risk of cardiovascular disease, for example, some cancers, and also the risk of developing type 2 diabetes. But essentially, fitter people live longer. So we see a 20 to 30% reduction in the risk of early mortality among those people who participate in regular physical activity. So really, physical activity is medicine for the whole population. But what about then the specific benefits for young people who have had cancer? So research shows us that young people who participate in regular physical activity have improved markers of cardiovascular health, including lower blood pressure and improved lipid values. We see huge improvements in their neurological outcomes, healthier body composition. We see improvements in their glucose homeostasis, reductions in their levels of fatigue, an increase in their muscle strength, and also provides an opportunity to expand those social connections that the young people may have lost during their long periods of treatment. All of these factors then contribute to huge improvements in the quality of life among young people who have had cancer. So we know exactly what physical activity is and why we should be doing it. So we know basically that exercise and physical activity is medicine, but what is the actual dose required to achieve those benefits? So the government recommends that every move counts. So what they essentially mean is to limit any time we're sitting for long periods of time and to replace this with some physical activity, where any physical activity is better than nothing. But more specifically for children and adolescents, they also recommend at least 1 hour each day of moderate to vigorous whole body exercise, such as running, jumping, skipping, walking, swimming, and so on. But it also recommends that young people take part in at least 3 days per week of muscle strengthening exercises. These guidelines then will assist the young person in achieving all of the benefits that I've just discussed regarding physical activity. Let's have a look now at kind of exercise in pediatric oncology specifically. So one of the world leaders in this area of research is a research team over in Germany called Network. Versus the time, I'll just share 2 recommendations. So their first recommendation is they recommend that physical activity should be integrated into the usual care from the point of diagnosis for that young person. So from the moment that young person enters hospital to begin their treatment, they should be offered opportunities to participate in regular physical activity. They also recommend that the physical activity program should be personalized to cater for each young person's side effects. Given the magnitude of the side effects that I mentioned at the very start of the presentation, it differs for each young person depending on their cancer type, their treatment pathway, their length of their treatment, and so on. So it's essential that the physical activity program is personalized to cater for their needs. But what about how many people are actually taking part in physical activity and reaching those guidelines that I mentioned of the 1 hour each day or 60 minutes? So, a WHO study completed in 2021 shared that up to 80% of school-aged adolescents are not reaching the physical activity guidelines. So, up to 80% are not taking part in the minimum of 60 minutes each day. More specifically, then, in Ireland, research tells us that up to 64% of males and 80% of females are not reaching that physical activity guideline. More specifically, then, what about our childhood and adolescent cancer community? So we know research shows us that 66 up to 92% of young people between the ages of 9 to 16 years old who have had cancer are not reaching the physical activity guidelines. So for both of these groups, it's a missed opportunity for these young people to attain all of the physical, social, psychological, emotional benefits that are associated with physical activity. What about then if we look a little bit deeper into the childhood and adolescent cancer survivors? Among that statistic, so if you think about 66 to 92% of young people who have had cancer are not achieving the benefits. It's even more prevalent among those young people who have had a central nervous system tumor or a cancer reoccurrence. If they're overweight, if they are an older adolescent, and also if they are female, we're seeing lower levels of physical activity specifically among this cohort. And we know that young people who've had cancer are taking part in approximately 9 hours each day of sitting behaviours or sedentary behaviours. But what makes physical activity extra challenging for young people who have had cancer? We know, so research and the evidence shows us, that they may have reduced physical functioning or reduced muscle weakness. They may have high levels of cancer-related fatigue or reduced lung capacity. They may have poor balance or a loss of fine or gross motor skills. There's limited opportunities for them to take part in inclusive physical activity in the community. There's social exclusion and there's a lack of adaptation to accommodate their each specific unique needs. They also see lower motivation, higher levels of fatigue, there's a lack of trust in their own body, and there's also sometimes a lack of awareness of the late effects of cancer treatment. So just to recap, we know that we have an increase in the number of young people who are living after cancer. But how can we actually support them to live well after cancer? So this is where my PhD comes into play, and we're going to address this problem. So throughout the presentation today, my PhD is broken down into 3 different studies, and we'll look at each of these in a little bit more detail. But before I do this, I'd just like to share a little bit of information about my incredible patient advisory group. So my patient advisory group include 3 families, so a parent and a teenager who has had cancer, and they're located from different locations in Ireland, different genders, and also different cancer types. And we meet 2 times each year, and the purpose of this is to discuss various different tasks within the research. So ultimately, they are guiding the research and are part of the research team. They review various different research materials, they support our recruitment, they co-analyze our data, and they also will assist with co-disseminating our information to the public. So as you can see here, they're involved in multiple different steps across the 4 years, and they are always at the center of our research, and they oversee everything that we are taking part in. Why do we include then families in our research, and what is the benefit of it? So it ensures that the research is conducted with and not just for patients. It ensures that the research is relevant and meaningful to this population. It ensures that the research quality is optimized. And then ultimately, all of this ensures that the research impact is greater. Now, let's have a look at study 1 of my PhD. So the aim of this was to identify challenges and solutions with regard to physical activity and dietary behaviour before, during, and after cancer treatment. So who exactly was involved in this study? So we had teenagers aged 12 to 16 years old who had completed active treatment. We had young adults who were diagnosed or completed treatment between the ages of 12 to 16. We had parents of teenage or young adult survivors of cancer. And we also had healthcare professionals involved. So, what exactly did we explore then with this study? So, we gained information on the physical activity levels before, during, and after treatment, dietary behaviours before, during, and after. And also, we gained their recommendations for a support programme for young people who have had cancer. But how did we actually go about completing this type of study? So we completed interviews both online and in person with all of the groups that I mentioned on the very, very left-hand side. And what we did was we audio recorded these interviews and then transcribed them, so typed them out word for word. And to analyze this type of data, which is called qualitative data, we use what's called thematic analysis. And this is a really, really rigorous 6-step process to analyze all of the information that we gathered. From this, we then developed various different themes on the information that we did gather, which I will be sharing in a moment. But before we do that, who exactly actually took part in this research? So among our adolescent and young adult, which is our AYA, we had 70% female and 30% male participate. And regarding the cancer type, we had 40% who had a brain tumour and 10% of the cancer types you can see on screen here. What about our parent cohort? We had 92% female and 8% male. And among those parents, though their young person had 42% brain tumour, 25% had leukemia, and 8% had the remainder cancer types on screen. And what about then our healthcare professionals? So we had 67% female participate and 33% male. And we set out to gain a wide range of perspectives from the healthcare professional world, including medical professionals such as the consultant in oncology, a consultant in hematology, an advanced nurse practitioner, a clinical nurse specialist, a physiotherapist, dietitian, play therapist, psychologist, and occupational therapist. So as you can see, there's a great range of both medical and allied healthcare professionals involved in this study. So as I mentioned, we developed various different themes from all of that information. And the 4 themes include physical activity across the cancer journey, the complexity of dietary behaviour, the absence of an urgent need for physical activity and dietary support after treatment, and recommendations for a support programme. So within this study, we gained a wealth of knowledge, but just for the purposes of time, I'm just going to show you a little insight into each of these themes. So let's have a look at physical activity across the cancer journey. So prior to being diagnosed with cancer, our participants shared how we had 2 main groups of young people. The first group were our sporty group, where they participated in regular sporting activities such as Gaelic soccer, hurling, swimming, hockey, and so on, with 1 to 2 sessions each week at a moderate to vigorous intensity, and they also had a match at the weekend. Our second group that we identified was those young people who just participated in regular day-to-day leisurely activities. However, during cancer treatment, both of these groups shared how there was a sharp decline in their activity levels. This was primarily as a result of 2 factors, including the treatment-related side effects that they were experiencing and the environmental factors. So let's have a look at the treatment side effects. So many young people shared how the impact of chemo cycles, neuropathy, which is the loss of feeling in their hands or feet, or tingling and numbness. They may have been immunocompromised, which limited their ability to take part in physical activity. Regarding then the environmental factors, they were physically restricted, maybe to their room if they were attached to IVs or drips and so on. There was a lack of opportunity within the hospital environment to participate in physical activity. And also, many of the people that we interviewed for this study may have undergone treatment while the COVID-19 restrictions were in place. So this cohort shared how the impact of those restrictions negatively impacted their ability to be active, so including the teenage room, the kitchen, the parents' room, and so on, were closed due to those restrictions. After treatment then, our participants shared how their engagement in physical activity was dependent on their degree of treatment-related side effects that they were experiencing, with some attempting to return to their previous activity levels, but with many sharing how there had to be daily adaptations depending on the type of side effect that they were experiencing, with some sharing how they may have had to utilize a crutch or a wheelchair as a pain management strategy. Our second theme is the complexity of dietary behavior. So before being diagnosed with cancer, our participants shared how they just had an overall balanced diet. However, during cancer treatment, their eating behavior was extremely complex. Similar to physical activity, this was as a result of primarily two factors: treatment-related side effects and environmental factors. So many of our participants shared how there was many taste bud changes, nausea and vomiting difficulties, chewing and swallowing as a result of their treatment type or the type of treatment where it was located on the body. Others shared how the environmental factors negatively impacted their ability to engage in dietary behaviours, such as the lack of hospital facilities. For those young people who were in isolation, depending on their treatment type, they had to engage with sterile foods and so on. So they had to engage with a clean diet. There was also the social implications of being unable to engage with their peers and take part in those typical day-to-day teenage activities, such as going for a meal or going for dinner with their friends. After treatment, then, their ability to engage with appropriate dietary behaviours was once again depending on their treatment-related side effects that they were experiencing, with some attempting to return to previous dietary habits, but others then sharing how it really depended on the type of side effects that they were experiencing. And many shared how the treatment-related side effects that they experienced during treatment, such as taste bud changes, swallowing and chewing difficulties, did transition into their survivorship phase and still negatively impacted their ability in post-treatment. Our third theme was the absence of an urgent need for physical activity and dietary support after treatment. So from speaking to our 31 participants, it was evident that there is an absence of support as part of usual care for both physical activity and dietary support after treatment. Many shared how there's a lack of information that enables families to self-manage their side effects effectively, so they felt as on their own and in isolation. And many also shared how one size does not fit all, that personalised supports are essential for young people after treatment. So now I'd just like to share from the family perspective some quotes to illustrate each of these main points. So treatment finished, the world stopped, you're on your own. So here I have a parent of an adolescent female that was diagnosed with a brain tumour, illustrating how they had extreme feelings of isolation after treatment. Here I have, it's worse than it ever was now. Diagnosed 9 years ago, and it's the worst it's ever been in all that time. So here this family are showcasing that the side effects that they were experiencing during treatment didn't end when they rang that bell and finished their treatment. It continued nearly up to a decade after they completed their treatment. Here I have a young adult female who was diagnosed with non-Hodgkin's lymphoma share how I wasn't told how to exercise like safely. I was just told not to exercise, and that was just the end of it. So here this young adult is sharing how there was no adaptation or inclusiveness regarding her physical activity guidance that she did receive, given the magnitude of side effects that this young person was experiencing. Physical activity was not adapted to her capabilities, and she was just told not to exercise, and that was the end of that story. So then what did we gain from the families? So we also gained information on what they wanted included in a type of support program for young people. So the type of information we gathered was they were looking for a 12-week program with one session each week for approximately 1 hour. That was both in person and online. That included both practical and educational components. That included whole body activity, muscular strength, aerobic balance, flexibility. So all this wide variety of activity to be included, and to also to have a family involvement within the program. So now I've given an insight into what exactly do families living in Ireland want. So we've identified the problem, we've spoke to all of the families in Ireland, but how can we actually use all this information and develop a solution to support young people who have had cancer in Ireland? So next we'll move on to my second study. So this was a 2-year process that involved 5 different steps. So first of all, we looked at the scientific evidence. We then applied behavior change theory. We explored what families wanted. We created a program, and then we spoke to the experts. First of all, let's take a step back and look at the scientific evidence that is available for this community worldwide. So research and scientific evidence tells us that supervised sessions result in higher adherence among this group. To incorporate multiple types of activities such as strength, endurance, flexibility, balance, fine and gross motor skills, and so on. That a personalized program is essential for young people who have had cancer, and to ensure that the young person is involved in the decision-making process as to the type of exercise or activity that they participate in. To also include both practical and educational components. And finally, then, to include behavior change techniques. So what exactly do I mean by behavior change techniques? And this will bring us on to our second step of our 5-step process. So we have applied what's called a behavior change wheel. So if you think of a scientist, many scientists work in a lab with test tubes, microscopes, cell culture, and so on. Other scientists work with understanding why we do what we do and how we can change our behavior. So using what's called the behavior change wheel, we delve a little deeper into understand the young person's capability for physical activity, if they have opportunities to engage in physical activity, and what is their motivation to take part in physical activity. And using all of this information, we develop various different strategies that underpin this type of program. The type of strategies that we use might be including setting some goals, identifying a problem with that young person, and together developing a solution as to how they can overcome that problem. And ultimately then, this will result in long-term success with changing their behaviour on a positive note. Our third step of the process was exploring what families wanted. So if you remember back to the very first study that I shared, the type of information that families wanted, including in a support program for young people, included a 12-week program, both in person and online, that the family were involved, that it was adaptive and inclusive to all capabilities, and for 1 session per week for approximately 60 minutes. What we did then was we used steps 1, 2, and 3, so all that scientific evidence that we know about, behaviour change, and then what Irish families wanted, and we created the first version of CHAMPS. Following on from this then, what we did was we showcased the first version of CHAMPS to our experts. But who exactly are the experts? So we had young people who have had cancer and their parent take part. We had young adult advocates who have had cancer. We've had charity representatives. And how did we go about this? So we completed 2 workshops online where we showcased the first version of our CHAMPS program to all of these experts, and they shared their feedback on the acceptability of each of the components that were involved in the research. They offered refinements and recommendations on how we can actually improve the program. So some examples of the results included maybe altering the session timings. They offered strategies on how to engage the family and the young person, the importance of family involvement, and then the logistics of how to actually run this type of program. So here we have our 5 steps together, and ultimately then, from our last step of speaking with the experts, we applied their feedback, which ultimately then confirmed our CHAMPS program, which is the Childhood and Adolescent Cancer Survivors Physical Activity and Movement Program. So what exactly is involved in CHAMPS? So CHAMPS is a multi-component program, and within that we have Let's Move Like a Champ, Let's Learn Like a Champ, Becoming a Champ, and our CHAMPS toolkit. So let's have a look at each of these components in a little bit more detail. So with our Let's Move Like a Champ, so this includes 12 weekly personalised sessions, where the first 8 sessions are in person in the young person's home. So I travel to the young person, so they're in an environment where they're comfortable engaging in physical activity. The next 4 sessions, we transition into that online environment where it's just myself and that young person on Zoom having a personalized session. And ultimately, all sessions are guided by that young person. So, for example, if you think back to all of the side effects that young people who've had cancer may be experiencing post treatment, the sessions then are tailored depending on how they're feeling on that day. So, for example, on a specific day, if they're having extremely high levels of fatigue, we're able to adapt that session to ensure that they're still able to take part in physical activity, but just where they're feeling a little bit more comfortable. And typically we aim for 60 minutes of a session, but then again, it depends on how they're actually feeling on that specific day. Next, we have our Let's Learn Like a Champ. So this includes 3 interactive educational workshops. These occur for 15 minutes long and involve the family. And within that, then, we learn about the science of physical activity and exercise. How can physical activity support any side effects that the young person may have? And here I just have some examples as to the type of information that we learn about. So what is physical activity? All the different types of activity that we can take part in, and why is it essential, and what are the benefits for our body and our mind? Next, we have our Becoming a Champ. So here we have 3 Becoming a Champ workshops that take place throughout the 12 weeks. And similarly before, these are 15 minutes long. And the aim of this is to support the young person to succeed in making physical activity a part of their everyday life. And we use what's called motivational interviewing techniques specifically within these workshops. So when I first meet the family, they're provided with their Becoming a Champ plan. And this is to supplement our Becoming a Champ workshops. And within our Becoming a Champ plan, we discuss various different topics, such as setting goals for short, medium, and long term, understanding what makes physical activity difficult for that young person, and together as a team, developing a solution as to how they can overcome that difficulty that they may be experiencing. We also then have our Champs Toolkit. So on the left, you can see our Let's Move More. And this is a physical resource for families to use throughout the program. So any of the information that we cover in the likes of our educational workshops, our Becoming a Champ workshops and so on, is supplemented also in this Let's Move More book. So they have a physical copy to resort to after the program finishes. The young people also have access to a YouTube channel where they can gain information on the types of activity that they can take part in, or like a session. So for example, we have full 60-minute sessions online, but we also have little 5-minute activity snacks. So specifically for those young people who may have high levels of fatigue, the 5-minute activity snacks are great just to get their body moving, but not use up too much energy. The young person then also self-selects an equipment kit bag. These are the most common equipment that have been selected to date by our Champs participant. So we have a great range of equipment available to that young person. So for example, an agility ladder, ping pong or table tennis, tennis balls, yoga kits and dumbbells and so on. So the young person then will self-select the type of equipment that they would like purchased for them. So we've gone through exactly what Champs is and the multiple different components, including Let's Move Like a Champ, Let's Learn Like a Champ, Becoming a Champ, and our Champs Toolkit. So let's move on then to my most recent part of my research, which is our study 3, and let's get actually started with Champs. So the primary aim of Champs was to see, can it actually be delivered to childhood and adolescent survivors of cancer? And the secondary aim is to see, is Champs acceptable to families, but also is it effective in improving their physical activity, their physical function, and their quality of life? So regarding our first aim, so can it actually be delivered? How many young people sign up? How many young people complete each of the components that I mentioned? How many actually finish the 12 weeks? But also, is it possible for me to travel around to all of these young people located across the island of Ireland? Our second aim, as I mentioned, to see, is it acceptable to families, but also is it effective? So the young person is provided with a physical activity device that is worn on their thigh for 7 days and tracks all of their physical activity engagement. They also self-report their physical activity levels through a questionnaire. We gain information on their quality of life through a questionnaire, And all of these assessments are completed before they start the program, when they finish the 12 weeks, but we also want to see the impact of the program long term. So we follow up with the families both 3 and 6 months after the program has been completed. Having a quick look at our physical function assessments then that we complete with our young people. So to gain information on their cardiorespiratory fitness, they take part in a 3-minute step test. We have a 30-second sit-to-stand test, which looks at their lower body strength and endurance. They have a handheld device to analyse their hand grip strength. We have our balance assessment using the Berg 14-item balance scale. And then they also complete a mobility assessment looking at their timed up and go. So I'm delighted to say that CHAMPS was officially launched in the first quarter of 2024, and ultimately we will have 3 groups. So our first group, which began in spring 2024, we've seen max recruitment rate for this group. We've also seen 100% adherence rates. Just from my observations, I've seen improvements in their mood, because when we take part in each session, they complete a mood questionnaire before and after each questionnaire. Based on my interactions with the families, we've also seen high family enjoyment. I'm unable to share exact results to date as this trial is still underway and we're still recruiting then for our 3rd phase. So our summer term is currently underway, and then we will open recruitment then for our 3rd term to begin approximately September-October timeframe. So let's have a quick look at what this actually looks like. So the home in the middle is where I'm based. So I'm based up in Athlone in County Westmeath, and I travel to all of these young people who are located across the island of Ireland. So we have families in Donegal, Meath, Dublin, Carlow and Cork to date. As this is a feasibility study, so the first of its kind to be completed, we do expect small numbers to understand to see if it actually is possible to complete this type of program and to see the preliminary effectiveness on their physical activity, physical functioning, and quality of life. So to date, we've had 13 enrolled in the program, which is our max recruitment. So it's the max amount that I'm able to see for the terms. But what exactly then are the next steps for the PhD? So we've spoke about CHAMPS, so you understand exactly what's involved. I would discuss then that we've actually launched CHAMPS and we're into our 2nd group, so our summer term. But what are the next steps? So obviously then the next step would be to move on to CHAMPS term 3 to begin September-October timeframe. What we will also do with anybody that completes CHAMPS, we'll complete a debrief interview or focus group. And the purpose of this is to gain their information or their recommendations on how we can actually improve CHAMPS for future participants, and if there's anything that we need to refine regarding how it is delivered. We'll analyse all of this data, which will be then shared both nationally and internationally through, for example, conferences, journal articles, presentations, webinars, and so on, to both the academic and the public community. I'll also then complete my PhD thesis and viva in 2025. But let's take a step back, and what is the future of CHAMPS and what is the ideal? So what we would love to have is to secure further funding. And the purpose of this further funding would be to complete a larger effectiveness trial. And what I mean by this is the next step in research. So what we're running at the moment, so CHAMPS, as I mentioned, is a feasibility trial. So it's the very first step in research to see actually, is it possible? The next step would be then to complete a larger effectiveness trial. So with this, then we would have a control group and our CHAMPS participants to be able to compare the results between both groups. We would also look to complete an economic evaluation to see what are the actual costs associated with delivering this type of program for young people. The aim then would be to partner with an industry or collaborate with an industry partner to then deliver CHAMPS as a formal service and have a team behind CHAMPS delivering it across the island of Ireland. And what is so important about this research that I've just discussed? So if you think about study 1, which was all the interviews with families, study 2 was actually creating a type of program using our 5 different steps. And study 3 was then actually delivering the program. So why is all this research important? So the information that we've gathered to date is the first of its kind in Ireland, but also worldwide. So other studies have explored the healthcare professionals' opinion alone, young people's opinion alone, and so on. But our study had a combined participant cohort where we were able to then delve a little deeper and understand if there was any commonalities between all of our participant cohorts. This will provide evidence then for both charity and government representatives to advocate for improved services for young people who have had cancer. CHAMPS then is also the first of its kind globally to be completed. So as it's the first globally, it's primarily home-based. So we're stepping away from that clinical environment of the hospital, where we're completing CHAMPS completely in the young person's home. So CHAMPS then is the first to actually complete this type of method. If you'd like to get involved with CHAMPS, the next term, as I mentioned, will start approximately September, October this year, so 2024. And you can private message on Instagram at jennyfitz.phdstudent or email a0024942@student.tus.ie. I'd like to just mention a few people, if that's okay. So a special mention to all of the absolutely incredible families that have participated in this research. So a special mention to our patient advisory group of our incredible 3 families and also all of our 31 participants that participated in the interviews and all of our current CHAMPS participants. A special mention then to obviously my co-funders who without the funding this research would not be possible. So the Irish Cancer Society and the Technological University of the Shannon, to my incredible supervisory team and my affiliation with the She Research Centre in Toulouse. And I'd also just like to have a special mention to Evelyn from Canteen Ireland. Evelyn, from the moment this research commenced, has been an absolutely phenomenal support with getting this research up and running, supporting the advisory group, our interviews, and actually CHAMPS itself. So thank you to Evelyn also. Here's my social media accounts if anybody is interested in following along, and I have some references, but I'll just stay on this slide here.
Thank you so much, Jennifer. It's not that we don't love references, but always nice to have your details instead of them. That was just a wonderful talk, and I just think the insight into the power of what you can achieve by supporting young people as they navigate that post-treatment life. It's just fantastic. And I think that this is definitely a talk that we'll probably be coming back to over and over again, and people will probably watch the recording because there's a lot to learn from it. And you covered a lot, which is fantastic. We do have a few questions that came through in the Q&A box. So we've got 10 minutes. We'll be okay. One of the questions I thought was very interesting was about working with the parents and guardians. And did you find that the parents had different views to their children? Because you did mention as well, some people were told not to exercise. I wonder,
Yes, so
what the
that was one benefit of having all of our participants included in a one study rather than individually just speak to young people, individually just speak to their parents and their healthcare professionals. So combining all of their information in this one type of study, we were able to see if there's any commonalities or differences regarding their physical activity. So regarding both the young person and their parents, we didn't actually see much differences between their opinions that they did share about how they were able to participate in physical activity or their dietary habits before, during, or after cancer treatment. There was some differences among the healthcare professional opinion where they shared how maybe if a young person was active prior to being diagnosed, that they continued that momentum regarding their sport activities, but then the families shared that sometimes it was just not possible depending on the side effects that they were living with at the time during treatment, following on to their after treatment phase.
Okay, yeah. Well, that's good that they're on the same boat roughly and they're going in the same direction because it could be hard, I think, getting your opinion across when you're young as well. So it's nice the parents are responding well.
Exactly, highlight. We did interview them separately as well.
Yeah,
So
great.
that was a great benefit as well. The young person, just myself and the young person in the online environment. So they felt open to share their opinion without feeling the pressure of a parent sitting beside them.
Yeah. And to this is another question here that kind of feeds in really nicely to that as well is, did you find that whenever a doctor suggested CHAMPS that you might have had better uptake, or even a healthcare professional, someone that maybe is seen to be in that position where they would usually be giving advice?
Yeah, so that was one topic we did explore during the interviews, so the very first stage of the research. So we asked where kind of would we, I suppose, advertise this type of program and where would we see more uptake. And it was
Mhm.
recommended to go through the hospital, but just given the time frame of ethics and the change from the hospital, the CHI Crumlin over to the new hospital and so on, the length of time to get that ethics approved
Of
just wasn't
course.
possible given our 4 year process. But saying that, we've gone through social media and word of mouth, and then also through Canteen Ireland, and we've had max recruitment rates with that. So that has proven to be extremely
Fantastic.
successful to go through that method, also, which is fantastic news.
Yeah, it's interesting with rehabilitation services, I think, across the board, even beyond oncology, there's always that wonder of, the reach and how you're going to get people involved. So it'd be an interesting thing to look at, I think, in the future as well. We had two questions about gender, and I think it was a very interesting point that you made about, with females and their participation. So one person had asked if or why you felt that the females were less likely to reach the recommended physical activity goals in this particular group. And then another person had asked then, was one gender maybe more likely to go back to physical activity after cancer treatment, or was there no difference? So maybe if you wanted
Yes,
to
so the
approach that.
first part of that. So if we see among peers and then the childhood and adolescent cancer community specifically, females are engaging in less physical activity. And this is due to multiple different reasons. So if we think of adolescence, there's all puberty, hormonal changes, and so on, where they may be struggling with their body image, there may be menstrual cycle, all of these changes to their body, which can
Mhm.
negatively impact their ability or their thought process around taking part in physical activity. So they were some of the reasons for the differences in gender. And then the second half of the question, you might remind me.
Yeah, it was just about the was one gender more likely to go back to physical activity after cancer treatment than the other?
So we didn't see a correlation between gender with that. It just was primarily dependent on if they actually engaged in high levels of sport prior to being diagnosed. They did attempt to return to their previous sporting activities. But then again, there was no difference between gender there. It just depended on if they were actually sporty background previously.
Yeah, no, that makes perfect sense. So if the predisposition, if less females were in that kind of organized sport before they ever ventured into the oncology world, that would have had a profound effect then as
And then
well.
it just
Okay.
depended on their degree of treatment related side effects that they've been
Mm,
living with. Like, say, for example, if we had a young person that was heavily involved in tennis, and then after treatment, they had left-sided weakness, balance difficulties, and so on, and
exactly.
severely negative their ability to get back to their previous sporting levels. But they did
Yeah.
attempt to slowly return.
Yeah, excellent. And someone, I think it's nice to ask about you sometimes beyond the work, which is a lovely question. So someone was said that your talk was very interesting, and they were just wondering what got you interested in researching physical activity in this population.
Yes, so my background is in physical activity and health science from what was previously Athlone Institute of Technology and is now the Technological University of the Shannon. So throughout this degree, we learn about physical activity, dietary behaviours, and then also how to change behaviour. And within all of the modules that we cover in the undergraduate degree, we learn about all the clinical populations, such as cancer, obesity, heart disease, and so on. But so I gained a great insight into cancer, but then I also had another love for youth physical activity. So what I did then was combined both those interests and with the team then discovered that there actually wasn't supports available for young people who have had cancer. From that then the idea grew and then that's where we are today.
Yeah, fantastic. Oh, yeah, you have to, it's a passion project, so you can clearly see you're very passionate about it. So it's wonderful to have you leading on this type of work. Someone was wondering about the workshops, and obviously time is always of the essence. So did you find that the 15 minutes was enough for delivering those workshops?
Yeah, so originally we had set out for a 30-minute workshop, but then when we spoke to the experts, so the young people who've had cancer, young adult advocates, their parents, and also the charity representatives, they recommended to actually reduce that time frame, given that the young people may have high levels of fatigue, but they may also be coming from their school day. The 30
Yeah.
minutes just didn't seem acceptable at that time. We do actually cover a lot of information in the 15 minutes, and it is interactive using our Let's Move More book. And then we also have the tablet where we're able to visually see. So it is a verbal discussion. So they are gaining more information rather than just sitting nice and quietly and listening.
Yeah, so like a check-in as well, almost, rather than, yeah, so they're actually going and doing the activities then themselves, but you're setting them up for that
Yeah.
success, I suppose. Fantastic. And someone else was wondering about obviously feeling very fatigued from treatment and the side effects and the after effects. Do you have any advice on I don't know if this is coming from maybe a young person or even just generally somebody who is going through cancer treatment on how to get started with exercise? Any quick tips?
Yeah, so really start low and go slow would be what we would say. So really low weights, adapt the activity. Like there's loads and loads of activities that will complete seated that uses less energy. And so for example, if I have a young person that has high levels of fatigue on a certain day and they say, right, I'd like to do this activity that involves standing, but their high levels of fatigue may impact that, we literally just adapt to change then to do seated exercises. So use low weights, even if it's just a water bottle rather than an actual dumbbell. Complete loads of seated exercises and low intensity exercises also, like a leisurely stroll, and short duration activities also. As I mentioned, the little 5 minute activity snacks that we have in Champs are
Yeah.
specific then for those young people who have high levels of fatigue, where it just gets their body moving, but doesn't eat into their energy levels too much. So start low, go slow, seated exercises, and then short duration activities also.
Yeah, and what you said as well about just don't forget there are so many different types. You know, you don't just have to run or you don't just have to swim. There are so many different types of exercise. So you can get creative as well, but low and slow. I like that. And we actually got a question, which is lovely, which is about the Irish Cancer Society and our supports that we have for children who have cancer. So if you don't mind me taking two
Quickly.
minutes or not even 30 seconds, we are so lucky at the Irish Cancer Society to have our own childhood cancer coordinator. So their job is just to ensure that we are responding in the best way possible, always to the ever-changing, vista of childhood cancer. So we also have an Irish Cancer Society Children's Fund that was deemed very important. And that's to offer some financial relief and support to the parents of children with cancer in particular. And then, of course, there are a wide range of tailored information booklets, one-to-one advice at the Daffodil Centres, but also online. We've got transport services for treatment and appointments, complementary and like holistic and creative art therapies, which look fantastic. And then obviously emotional support services that can come through online, at home, and in hospital support nurses. And one last one as well, which is probably people don't know about as well, a peer-to-peer parent support program where we team up parents of children who are undergoing cancer treatment with parents who have already gone through that process, because it can be a really, really difficult and emotional time. So yeah, making sure the parents are looked after as well. So we've answered all the questions, flew through those. So we might end it there with 2 minutes to go. Just want to thank you again, Jennifer. That was a wonderful talk, and we'd be delighted to put that up on our YouTube for anyone who has missed it today. I'd also like to thank Anya, who's just been sitting there quietly, who is our research support coordinator, who is the most helpful person in the world, who got us on here today, Jennifer. And thanks to everyone for attending. Do keep in mind, Jennifer and her team we will be recruiting for their autumn term shortly. So do get in touch, either through Jennifer or ourselves. Very happy to send on your details. If you've anyone in mind that might benefit from participating in such a fantastic initiative. And if you've any further questions, always reach out. You can email us at researchadmin@irishcancer.ie. And thank you all again. And we hope to see you at another webinar very soon.